My name's Tracy Bryce. I work at Mind Plus Neurology as the Director of Marketing and Membership Enrichment events like this one tonight. During our wellness workshops, we like to focus on educational tips and today our focus, we're talking about kids with migraine at school. And with that, I'm going to welcome our Sarah Arndt, the certified health coach, to give the presentation. Thank you.
Thank you, Tracy. My name is Sarah Arndt. I have been partnering with Mind Plus Neurology on these wellness workshops. It's my honor to be able to present in partnership today with Migraine at School and myself and my business, the Migraine Maven. And we are coming together here to offer you this free talk to help you, parents of children who may be experiencing migraine or headache disorder symptoms, to get the help that you and your children need and deserve. So that's kind of why we're here, which is the next slide, Tracy. You can really skip that. I already went over that. This is me when I was a very colicky baby. And interestingly, we'll talk a little bit more about colic being linked to migraine a little bit later on. I cried for the first 3 to 4 months of my life nonstop. And I truly believe that I have been experiencing head pain since the day I was born. Interestingly, when I sent these photos for this slideshow, I noticed that this infant photo, this newborn photo of me, I almost always have my migraine symptoms on my left side, which it might be mirrored in the video here, but you can see my left eye is kind of looking off to the side, is a little bit more closed in that newborn picture. And I feel like that's just even more confirmation that I was literally experiencing migraine pain and symptoms since the day I was born. And when I was a little girl, I experienced frequent headaches, extreme light sensitivity and sound sensitivity. I've always been really overstimulated when there's like a lot of bright lights and sounds and smells. And in 2019, at about age 35, I developed a severe migraine that was never ending for 2.5 years, refractory, meaning very difficult to treat, intractable. It never ended. I never knew when one migraine attack started or the next one, or it ended or the next one started. It was like continuous for nearly 2.5 years. And I thought my life was over. I thought that I was developing early onset Alzheimer's disease. My brain fog was so bad. I could never have done a presentation like this because I couldn't even speak 2 full sentences without losing my words, forgetting what I was saying, completely losing track of my train of thought. And I'm living proof that you can indeed heal from what feels like the worst migraine of your entire life. And it's an honor to work with Mind Plus and represent Migraine at School, and potentially help even just one child would be such an honor and such a cool part of my story. And so let's get into it. So migraine and children. So you can go to the next slide, Tracy. Migraine is a neurogenetic disease. It is not just a headache. It is so much more complex than that. It's genetic in nature, in the sense that if you as a parent have migraine, there's a 50% chance that your child could develop the condition. And if both parents have migraine, it increases to 75% chance of inheritance. So the prevalence of migraine in children and adolescents, 5% of preschool children, 10% of school-age children, and when I first saw the statistic, my mind was blown. 28% of adolescents have the potential to be diagnosed with migraine, and these numbers are likely low because the vast majority of people living with headache and migraine they go undiagnosed for their entire lives. So it's kind of one of my goals as an advocate to help people really get connected to the tools and the resources and the doctors to support getting a diagnosis and getting the care that we all deserve when we're living with this condition. So the onset of migraine in children and adolescents, it can start young. Like I said, I truly believe I have been experiencing migraine since I was a baby and screamed for months out of the womb. And scientifically, migraine has been linked to colic, which is really interesting to me, as well as a scientific link to motion sickness, which I experience still to this day. I need to be the driver of a car or a passenger for a very short distance. Riding in the back seat, not ideal for me at all. I actually feel physical nausea thinking about being in a back seat of a car because my motion sickness has been so severe for my entire life, especially when I was a child. And so both of these have been scientifically linked to migraine, which is really interesting. And if you feel comfortable sharing, feel free to share in the chat now if you or your children experience any of these symptoms. So pediatrics and migraine. Migraine looks different in children. So from a symptom perspective, attacks last 2 to 72 hours. You can go to the next slide, Tracy. With pulsing or pounding head pain. It can be felt in the front of the head, on one side of the head, both sides of the head, and it can worsen with activity. Interestingly, when I was a kid, I had pain like all over my head. I couldn't really distinguish a specific side, whereas now I very specifically have left-sided pain. And I wonder if I was experiencing different types of headaches, not just the migraine condition, not just, but not only the migraine condition that I have been diagnosed with now as an adult. Um, Tension headache, of course, is the most common form of headache, and it can be, it most commonly is right in the front of the head. But that doesn't mean we should not consider migraine as a diagnosis if that is what the child is experiencing, is that front of the head pain. So other symptoms include stomach pain, nausea, and vomiting. And in children, migraine can commonly manifest as abdominal migraine, which these three symptoms really, really speak to that diagnosis. When I was a kid, I had severe nausea, constant stomach pain, to the point that when I actually had appendicitis, my parents didn't believe me until it was like almost too late. Thankfully, I got to the hospital when I did. But I had complained of stomach pain constantly my entire childhood, and I do believe that I was experiencing abdominal migraine symptoms. And it's so easy to just brush those symptoms off as, stress or something else, but they very much can be linked to migraine, as well as a stuffy nose. I actually read a study once that over 90% of people diagnosed with like chronic sinus infections that are diagnosed by a non-specialist, meaning like an urgent care, emergency room, or primary care doctor, over 90% of them were incorrectly diagnosed with some sinus infection or sinus inflammation. It actually was migraine, which is really interesting. So a stuffy nose, sinus issues, and then sensitivity to light or sound, which I talked about a little bit of experiencing myself. It's a very common symptom of migraine, sensitivity to light, not just sunlight. I know that's the picture here, but also indoor artificial light. In fact, for me personally, sunlight is far less of a trigger than artificial light. LED lights particularly, and you can see it if you ever do like a slow-mo video on your phone, like of your kid or your pet or something, you can see like the light flickering really slow in the background. LED lights flicker super, super, super fast, and our brains very much sense that flickering, even though we can't see it maybe in our, visual spectrum. Our brains are certainly struggling with that, even if we don't live with migraine. There's tons of data showing how harmful artificial light can be for our health. And that sensitivity to light can be really tough for kids who are sitting under artificial lights all day at school. I just read a story this week of a teacher who lives with migraine, and she always keeps all the artificial lights off in her classroom, and she buys and brings her own lamps to school. And like all the teachers comment on like how calming her classroom is, and it's literally just because she's using incandescent bulbs, which are the safest for our health. And um, yeah, so it can be really tough for kids who are in school all day long under these bright artificial lights when they're experiencing light sensitivity. That in and of itself has been a huge migraine trigger for me. We'll talk about some ways that we can combat that in a little bit. But the sound too, I remember being a little kid and like parents want to take their kids to parades, right? Like that's fun. And I remember like standing like this always at parades because I was so overstimulated and my brain physically couldn't handle that loud sound. So we can go to the next one, Tracy. So how a student experiencing migraine may present. So ages 5 to 10, headache that affects the front of their head on both sides. They might look pale, have dark circles under their eyes, stomach pain, the nausea, the vomiting, and that sensitivity to light and sound. That's more common in the younger kiddos. And then adolescence is when aura may begin, which we'll talk about that in a second. We'll go a little bit more into depth in just a second about that. Pain in one or both temples, no appetite, nausea, diarrhea, or constipation. It can go either way. That sensitivity to light and sound, confusion or trouble focusing, we might call that brain fog, dizziness. I actually live with vestibular migraine. I failed to mention that. That's my diagnosis. So I get dizzy with my migraine, and gosh, I was experiencing dizziness in high school, surely, and just never ever put the two together. Poor muscle control or feeling clumsy. I know that when I'm having a really intense attack, I really struggle with coordination and just like walking, talking, my normal functioning can really be impacted. So visual aura. So blurred vision or loss of vision, zigzag lines, dots or flashes of light, a kaleidoscope pattern of colors. These last two, the objects looking smaller or larger than they are, and the straight lines looking curved. This has been broken down into what some have called Alice in Wonderland syndrome, which is fascinating, where you literally see things in a different shape or size, or they curve when they're straight or vice versa. And it's really quite remarkable how severely it can affect our vision. And you don't have to have aura to have migraine. I think that that's a myth that I often find, is that people think, oh, it's just a headache. I don't get that aura beforehand. And it's not necessarily true that you have to have aura, but this is what could potentially present, as well as these following symptoms on the next slide. So me personally, I've had two visual auras with like the zigzag lines. The first time I had it, I was absolutely terrified, but I knew exactly what it was because my mom had told me about her experience with aura when she was about my age. In my now adult life, and when I was really sick in 2019, 2020, I would get aura, and aura is the first stage of the migraine attack. It lasts between 5 and 30 minutes. And for kids, it can be like 5 minutes, like a very small window of time. But I would get, preceding a full-blown migraine attack, I would get numbness on the left side of my face, my left arm, my hand, and my fingers. And all of a sudden, like out of nowhere, I would seemingly just get numb and tingly on this left side, the top half of my body. And then it would be gone in 20, 25 minutes. And then the head pain and the other migraine symptoms would kick in. But otherwise, difficulty talking, confusion or trouble paying attention, dizziness, and ringing in the ears, or tinnitus is what it may also be called as well, can all be symptoms of aura. Although I would argue that the difficulty talking, the not the first one maybe, but the other four could also all potentially be part of the migraine attack itself. So sometimes it can be difficult to distinguish between the different parts of the attack, but that's not necessarily relevant for this conversation today. It's just getting yourself familiar with what these different things could look like in your child. So this is my favorite slide because I'm a certified health coach and I love talking about lifestyle changes in regards to health. And I'm a huge advocate in taking your power back, becoming you and your child's own doctor first, and really taking charge of the things that we have control over in our lives and are often free or like super reasonably priced, like high quality sleep. I don't have children of my own, but I have two nieces and a nephew who, my 15-year-old niece and my 10-year-old niece, they are not getting enough high quality sleep. They do not live with migraine, but they're not getting enough high quality sleep. I think a lot of kids aren't, especially because screens are so prevalent and so addicting in our modern day life, right? But high quality sleep is huge. Sometimes, like, my friends and even medical professionals have kind of given me a hard time because I need between 9 and 10 hours of sleep at night, or I will be so much more prone to having a migraine attack. Sleep is absolutely foundational for good health, and I just really like to talk about that one a lot. Drinking enough water, I think that that's pretty self-explanatory, but you'd be surprised how many kids are barely drinking even 8 ounces of water during their entire school day at school. In fact, I was just thinking the other day about how I never had a water bottle at school when I was a kid, and how, like, I had like 3 seconds after I came in from recess in a line of kids at the water fountain or the bubbler. You like had 3 seconds to take your drink of water, and the next kid in line got to go, next kid in line got to go, right? So that they could get through the line quickly. I was not getting anywhere near enough water when I was a child. And now kids can like bring water bottles to school. My water bottle is like my little infant baby. I bring it with me everywhere I go. And preferably filtered water if you are able to do that, and out of a stainless steel water bottle instead of plastic. But water is a really, really simple, go Tracy, really important tool in our toolbox that is, I guess, not free, right? We pay for water, but it's relatively inexpensive. And then avoiding artificial scents. And this means not just at school, of course, but in your home. I remember my mom wore like the sunflower perfume in the 90s. Oh gosh, the thought of it makes me sick to my stomach. I hated when she would wear that. My mom lives with migraine, so I have no idea how she tolerated that, first of all. But I cannot tolerate like any artificial scents. They're hugely triggering for me. And this includes like candles, like plug-ins, air fresheners in your car. There is nothing worse than taking an Uber ride and it just reeks like artificial scents. There's quite a bit of science that shows that not only is it harmful for a person living with migraine and very triggering, but it actually, these artificial chemicals are hormone disruptors. They actually really mess with our hormones, and hormones, of course, have been linked to migraine, especially in women. And we really need to be mindful of that for our children who might be experiencing migraine symptoms. Eliminating those things in your home could really have profound results as far as the symptoms that your child is experiencing on a daily basis. Those artificial scents are really harmful for our health. Something you could replace that with, I personally love peppermint oil. I have some with me right next to me on my desk. I have one in my car. I have one in my purse. I have them everywhere, in one next to my bed, so that I have one readily available anywhere I am. If I ever am um, if I'm ever somewhere where I have to be seated next to other people who could potentially be wearing perfumes, I'll bring my peppermint oil to put under my nose so that that's what I smell instead of the, you know, woman next to me with her sunflower perfume on. And then, of course, exercise and movement. It's so important for children to be active. We live such sedentary lifestyles these days. It's so important to prioritize exercise and movement. And then mindfulness and meditation, AKA allowing the body and mind a chance to really connect and slow down in this very fast-paced world that we live in. And keeping a migraine tracker or a migraine diary can be really helpful in um, establishing kind of a pattern in your child's migraine symptoms. And it's really great data to have for your physician, your child's physician, who can really work with you to create a good plan as far as, you know, how often, how frequently, the severity of the symptoms. And you can also track like foods and exercise, screen time, things like that, to see what's correlating with the symptoms, and um, really make accommodations or changes at home from a lifestyle and behavioral standpoint based on what you learn from that migraine tracker. And then last but not least, eating a primarily whole food diet and avoiding ultra processed foods. I just read a study this week. Children in America are consuming on average nearly 70% of their daily calories from ultra processed foods. And this is massively detrimental to their overall health and well being, and has massive implications on brain health and migraine. I talk about food a lot with my own clients and help them to make changes into their lifestyle to incorporate more real foods, whole foods, local, in season, natural, organic, again, non-ultra processed foods, because they're super inflammatory and very detrimental to our health, and again have massive implications on brain health and migraine and overall health. So in my opinion, these are the things that should be prioritized immediately so that the long-term use of medication can be avoided if at all possible. Moving on to medication, I am not a doctor. I am not an expert on medications, but there are options available for children from a pharmaceutical standpoint. And then there are also some non-pharmaceutical options as well. I would warn that the risk of using some of these over-the-counter meds, my drug of choice for many years was Excedrin migraine or Excedrin tension headache, any of the Excedrins that had the combination of aspirin, acetaminophen, caffeine. I very much overused those medicines and actually developed what we call medication overuse headache or rebound headache or medication adaptation headache. It has many different names, but basically our bodies become adapted to the meds, and basically our baseline, our threshold for what the meds will help with gets higher and higher, and we can't, or lower and lower rather, and the meds end up not helping as much, so we take more and more of them, and that actually can promote even more pain and symptoms, and it can contribute to uh, a random episodic migraine or headache condition turning chronic, which means 15 or more days a month, which we, of course, want no one to ever have to deal with chronic migraine because it's very debilitating. And I just like to warn about this medication overuse adaptation headache with these over-the-counter meds because it's so easy to overuse them, and it can actually make our symptoms worse in the long run. And your doctor should hopefully know more about that and can help guide you on that path for your child to maybe use something that is maybe a little stronger acutely in the moment so that you don't have to have your child be taking acetaminophen 7 days a week or ibuprofen 7 days a week. And then these alternative non-drug treatments, I love talking about neuromodulation because it's such a cool field of science. And basically there's a device called the Nerivio that has been FDA approved for children 12 and up, which I actually did not know that until this slide deck was put together for me. So that's awesome. And also, I just learned that neuromodulation can be considered anything that an external stimuli does to affect the nerve signals in our body. So, for example, using a cold ice pack. Some people like heat. I would say the majority of people like cold, but like I have like a headache ice pack hat that I wear that can really help relieve some of my symptoms. It's not going to cure migraine, it's not going to make it go away, but it can help give me a little bit more comfort when I'm experiencing head pain. I like to take a hot shower, interestingly, when I have a migraine attack. That helps me feel better, even though I prefer cold on my head. The hot shower still will make me feel better. And then, of course, cognitive behavioral therapy or biofeedback. We'll talk about that on the next slide, I think, too. And then FL41 lenses, or there's all different types of migraine glasses. I don't have mine on right now. I wear them all the time, though. These are Avalux brand glasses. They block specific wavelengths of light that have been shown to be triggering in people with migraine. They let in green light specifically, which has been shown to soothe and calm the migraine brain. And so, I mean, that's a simple solution for helping a child maybe who is having light sensitivity at school on a daily basis, a non-drug option. So mental health and migraine, people with migraine are significantly more likely to experience depression, anxiety, and die by suicide. 60 to 70% of adolescents with chronic migraine have either anxiety or depression, which is not shocking because chronic migraine is very debilitating and really takes away from quality of life. We want to avoid chronic migraine as much as possible, which is why getting children help early is key. But I'm a huge fan of therapy and counseling. I literally just had my session an hour ago. And there are unquestionably emotional implications when it comes to migraine that should be addressed. And so I'm a big fan of therapy and counseling for children and adults with migraine. So Migraine at School is the organization that we have partnered with to put on this presentation. And Migraine at School is set up to educate educators, school nurses, school counselors, and of course, parents and students how to support children who are living with headache and migraine disorders. And it offers information on how to work with kids who have migraine on accommodations. And there's tons of tools and resources that I'm going to show you. I'm so excited to show you on these next several slides. But first, Migraine at School is run by the Danielle Byron Henry Migraine Foundation. So Danielle was the daughter and sister of the family who runs this organization, this foundation. And Danielle battled migraine disease for almost 10 years until she died by suicide at age 17 in 1999. And the mission is to raise awareness, provide support, and access to treatment for those living with migraine disease, especially young children and adults. I get a little emotional every time I think about Danielle and all the children who suffer from this condition and feel hopeless and helpless. And I just always like to try to instill hope in anyone who is experiencing such debilitating symptoms on a daily or very frequent basis. There is hope. It is possible to heal from migraine. I am living proof. So let's dive into the amazing resources Migraine at School has put together for parents. So this first tool, things parents should know about migraine, this one has the most information as the parent needs to know and do the most for their child, for their student, right? There's only so much that can be done between school hours. And this encourages parents to educate themselves about migraine to help them better advocate for their child. It reminds parents to take migraine seriously, that not all migraine symptoms are just head pain, that many other symptoms like nausea, vision changes, tinnitus can all be associated with migraine, and it recommends scheduling an appointment to see their doctor. And then the back of this form is steps parents can take to get their child the help that they need to get a proper diagnosis, encourage them to see a headache specialist or a doctor who understands migraine, and help their child manage their lifestyle choices, including limiting screen time, eating real whole food, brain healthy meals, getting good sleep, managing stress, and consideration for meeting with a pain psychologist or another mental health professional like a therapist or a counselor to identify possible coping strategies. And then finally, look into getting accommodations for their child while at school. So this is a list of possible accommodations. We'll talk about specifically 504 and IEPs in just a moment, but I love this list of possible accommodations. This is not, these are one size fits all, but certainly can be tweaked to better fit your child. And I don't think I mentioned that we're going to link, and there's also a QR code at the end for you to get direct access to all of these forms. All of them can be printed. They can be, I believe that the Migraine at School will mail you these forms if you would want them mailed to you for free. Everything that they do is for free. It's such an amazing organization. So this is a list of accommodations that we could potentially look at for a child who is experiencing migraine or headache disorder at school. I'm not going to read through them all, but you certainly can. I would encourage you to look at this form on their website and consider requesting some of these accommodations. We'll talk about how to like make a request in just a second. So this is a screening tool, a document that helps parents gauge their child's symptoms, and it suggests sharing it with your child's doctor to assist in getting a proper diagnosis and treatment plan. It's really important to catch migraine symptoms early on because the earlier that symptoms are treated, the less likely they are to become chronic, which can be so very debilitating. And it's known that episodic migraine, those that occur occasionally, can become chronic 15 or more a month. In many cases, we can prevent this through early intervention, and that's why we offer this screening tool. This screening tool is a questionnaire, and if any of the boxes are ticked, migraine should be suspected. This is also available on their website for you as well. Next is a healthcare provider letter. Having a simple letter from a doctor can make a huge difference in getting your child the accommodations they need at school, perhaps without ever needing to actually formally request a 504 plan or IEP. So I know that accommodations form said 504 accommodations. If your child's school is super accommodating and they are willing to make some accommodations for your child without like a legal document or a law-abiding document like a 504 or IEP. Excellent. Some schools, some school districts are not as accommodating or willing to support a child with migraine because it's an invisible disease. They might think that the child is faking, et cetera, et cetera. And it might be necessary to actually request a formal 504 plan or IEP. But having this letter from a doctor, which this template is available on their website, can be really helpful in instilling these accommodations in your child's school and their daily plan. So 504 plans and IEPs. So a 504 is defined as a plan developed to ensure that a child who has a disability identified under the law and is attending an elementary or secondary educational institution receives accommodations that will ensure their academic success and access to the learning environment. 504 plans provide accommodations without the need for specialized instruction, and they don't get updated every year necessarily. IEP stands for Individualized Education Plan, and that's a legal document updated annually that lays out special education instruction, supports, and services that a child needs to thrive in school. So these are more formal requests for accommodations. 504 might be the first step if your child's school isn't willing to make some of those accommodations on that previous form. Which like some of those accommodations might be like adjusting lighting, allowing extra time for tests, allowing water or snack breaks when students normally wouldn't get them. If your child's school is accommodating and willing to offer those things without these plans, that would be ideal because it's a lot less work for you to maintain all of this. But if the school is not as willing to be flexible and support your child, these are legal documents that the schools legally have to follow to support your child in their education. So these are some tools now for students. So do you have migraine? This tool offers students symptoms to look out for, and it encourages kids to talk to their parents about seeing a doctor. And we talked about all of these different symptoms. Next slide. I love this tool because this is for kids to kind of navigate individually using their own self-advocacy skills that you may need to work on teaching them ways to cope with migraine and manage migraine. So it really helps give your child a voice and encourages them to advocate for themselves, which interestingly, actually the next slide, help yourself by speaking up. So again, giving your child a voice is powerful. When I was a kid, and I used to work in neurology clinics for children with neuromuscular diseases, but in neurology clinics, and I can't tell you 90% of the time or more in my experience, and when I was working in neurology clinics, physicians were always looking at the parents to answer questions about the child's health. And I mean, I was even having my mom come with me to doctor's appointments when I was in college and looking to her to answer questions for me. And I really wish that we as a society did a better job of preparing children to be advocates for their own health and wellness at a much younger age. I think that our health outcomes would be a lot better if we were better at doing that. And this is a tool to help support your child in being a self-advocate for themselves. I encourage you as parents to support your child by, before you go to a doctor's appointment, encourage them to speak up for themselves, to share their own story, to share what they're going through, and not just look to you, mom or dad, guardian, to answer all those questions on behalf of them, because you're teaching your child then skills for the rest of their lives to advocate for themselves and their health. And I truly wonder how much different my health outcomes could have been if I would have learned those skills when I was in middle school or high school or college or before age 35, for example. So the Migraine at School website, like I said, has all of these free resources, and it's just such a remarkable organization to help support you as parents on your journey with your child navigating a potential migraine or headache disorder. And on this next slide, there is a QR code for you to scan on your phone to take you directly to the website. Otherwise, Tracy's going to drop the website in the chat right now for us too. And I would like to open it up for any questions. Does anyone have any questions?
I
I don't
had a
know if you,
question
yeah,
about like it's just some examples of those accommodations that were like some of them felt like the had to be more formally requested, and some of them could be just I don't know casually requested. But like, could you give us some examples of like what types of accommodations there could
yeah,
be?
absolutely. So like lighting, for example, is a huge one in my opinion. Um, allowing children to be in a room that doesn't have the artificial lights, which there's thousands of studies showing how harmful they are to our health, not just for people with migraine, or like having access to snacks is a simple one that teachers can be really hard to convince that a child needs a snack in the middle of third hour. But, blood sugar fluctuations can really be a trigger for me and for anyone experiencing migraine symptoms. And really keeping my blood sugar balanced by eating consistent meals and snacks is really huge for me. So maybe offering the child the opportunity to have snacks accessible at school when other children may not be allowed to have access to those snacks can be so simple but so very helpful. And then maybe um, allowing for some extra time to take tests or extra time to submit certain assignments. Um, I mean, if you like, I know when I was watching my nieces and nephew a few months ago, um, my niece came home. She is an ice skater, so she was done with school at 3:15, straight to ice skating at 4, came home at 9. She had a whole project she had to do the next day. If she suffered with a disability of any kind, it would be very difficult for her to get enough sleep at night, take care of herself, eat healthy meals, and do this whole project in one day's time. Maybe we can just ask for some extended time to submit assignments or extended time to take a test. Or maybe requesting breaks during testing. So, there's a lot of like timed tests that children have, and maybe we can offer them opportunity to take a bathroom break, a water break, a snack break, a brain rest break. Um, Maybe we ask for accommodations in physical education. Sometimes children can have um, increased symptoms from activity, from exercise, from high intensity exercise. So maybe if like I remember I was like forced to run the mile all the time in middle school and high school. And if I was experiencing a migraine attack on that day, that would be like human torture for me to do something like that. So, maybe even extra bathroom breaks. Allow children with migraine and headache disorders to use the bathroom during the school day when, teachers can just be really strict about some of these things. And if, like, again, if the school is willing to offer these accommodations without a law-abiding legal document, great. But these are things that you can actually write into a 504 plan or an IEP plan that legally the school then has to accommodate to support your child.
Awesome. Thank you for that. That's really powerful, and it does feel like it kind of puts the power back in the parents' hands, to help their child to be successful. I mean, that's really the bottom line.
Totally. And there's tons more on that form too. I just like use a few examples.
Mhm. Okay, so then thinking ahead about how a child can get help with headache or migraine, I mean, it's a good place to start to see they already have a pediatrician, so talking to their doctor is a good place to start. But we also are here to help at Mind Plus Neurology. We do see adolescent patients here as young as age 16. And then if there is a parent out there that would like to have help beyond a primary care physician, we do offer a referral program to Children's Hospital of Wisconsin, and they have a program there that is dedicated to headache and migraine as well. So if you want to give us a call for more information, it's 888-585-7975, or you can email us if you have a question, and maybe we can help direct you in the right direction, or start up a new patient consultation. We'd be happy to do that too. Email is info@mindplusclinic.com.
And if you are viewing this outside of the state of Wisconsin, Migraine at School's website has 2 different search tools for physicians for your child throughout the United States, which are really helpful. So feel free to use those tools on their website as well. And then like I said in the beginning, I have my own health coaching business, the Migraine Maven. I work with children, adults, families, people who are struggling with migraine and headache disorders and want to take a holistic approach to managing health. So I have a big focus on lifestyle and behavioral techniques and ways of life that have really helped me personally. I use my own personal experience healing from severe intractable refractory migraine to I don't even think I can be considered chronic migraine anymore because I experience 1, maybe 2 attacks a week, and I'm definitely not experiencing 15 attacks a month anymore. So, wow, that was a really fun aha moment for me right there. So I have essentially healed my body from chronic migraine, and I work with others to do the same from a lifestyle and behavioral perspective. So you can find me on Instagram at the Migraine Maven, or you can email me at the migrainemavencoach@gmail.com. I am working to launch a website, so if you are watching this later, go to themigrainemaven.com. That will be my website. So thank you so much for taking the time out of your day to support your child. And we are here at Mind Plus. We are here at Migraine at School. I can support through the Migraine Maven. We are here to support you in any way that we can. Do not hesitate reaching out. I'd be happy to take any other questions if there are any. You can pop them into the Q&A. You can come off of mute. I'll give everyone just a second if you have any questions.
In the
Otherwise, I
chat,
believe. Oh, go
sorry,
ahead,
sorry.
Tracy.
In the chat, I do have the links that we had talked about, the tools for parents, and then also the monthly newsletter link to get regular updates from Migraine at School, and then the email for contacting Migraine at School as well.
Perfect. Thank you for that. Thank you so much for coming. I hope this was helpful. I hope this was useful. And I hope that you have a great rest of your evening.